Hey guys, Dr. Ducey here. How are you? MTFUcoach.com. How are you? I haven't done many of these videos. Everything's on YouTube now, but this one's kind of important. I like to think they all are. My friend Dave Palumbo over at rxmuscle.com did a video today on Scott Milne, the Canadian bodybuilder, the giant that just passed away, unfortunately, at the age of 46. And Dave is heartening all of his subscribers to go out and get all their systems checked, get physicals and all that. I'm not parroting or copying what Dave said or did, but he did remind me this is a good topic because most of my members here aren't members on his channel, so they won't see that stuff. But in any event, Scott Milne loved bodybuilding, 46 years old, professional bodybuilder, a giant of a man, 6'3", 300 pounds. And he just loved bodybuilding. He wanted to stay big perpetually. He worked in the business, worked for a lot of companies, and that's what defined him. The word is that he died from a heart attack. I don't know that for sure. Dave doesn't know that for sure, but that's seemingly what the word is, and apparently his father also died from a heart attack. But listen, when you're carrying 300 pounds, and I've said this in the past, as you get older, the body does not want to carry all that weight, whether it's fat or muscle or whatever it might be. And the heart, and I've said this, the heart gets tired of pushing against that. And the heart takes a day off, and then you're dead, and that's it. So you've got to be prudent. You've got to be mindful of that. You've got to really kind of scale things down as you go. And it depends. Everybody's different. You've got to look at genetics, and apparently Scott, his father, had some heart issues. So there you are. Who knows? But for men and women in general, and I've always told patients this, and other prospects that I've worked with, you've got to look, you got to be attentive to the potential for prostate cancer, colon cancer, and breast cancer in men and women. And men in particular with the prostate, you should get that checked at the age of 20. And then every single year after the age of 40, you've got to look at a number called the PSA, that's found in the blood. And if that's below 1 nanograms per milliliter, that's okay. If it gets into the realm of 4 to 10, then you might have problems, and you've got to watch it. A digital exam, of course, to go in and check the integrity of the prostate itself, the size and the hardness or lack thereof. You've got to get these things done on a regular basis, and breast exams for women as well, mammograms and colon colonoscopies on a regular basis. That's something that is usually left to the end. A lot of people don't even get those, and you should get those at least once in your 20s, and then after 40, again, every several years. Some findings in the literature state every 10 years, 5 years. Just stay on top of it, especially if there's a family history. I look at my family history. My father, God bless him, just turned 80, and he is well. But if you go from head to toe, he's had a brain tumor removed about 15 years ago. He's got macular degeneration. He has to go for injections every 6 weeks. He's lost a lot of his vision. He can't drive anymore. Sits really close in front of the TV. He's had heart attacks, multiple angioplasties. He has diabetes. He's had his colon resection. He's had prostate cancer, and he's had some other things. So listen, I'm obviously of his flesh, genetically speaking. Even though I've really taken good care of myself, chances are something genetic encodement says that I may get one of those things. So I stay on top of it. I stay on top of things. And listen, even though you might eat like a Spartan, we've talked about this, high stress can still cause, even if your diet is clean, there's something in the body called mast cells that will release high cholesterol into the blood generated by the body, and that can cause plaquing. And all of a sudden you have blockages, and you're looking at a possible bypass surgery or even death. So you got to watch your stress, and you got to manage the stress, because if somebody just tells you decrease your stress, that's a bullshit. That's not advice. No kidding. How do you do that? You got to find a way. You got to be mindful of it. So get these things done. It's very important. And leaving off on this, I don't judge. I don't care what people do. But especially in our milieu, in the exercise and fitness world, ergonomic aids and drugs and performance-enhancing drugs and anabolic steroids, and growth hormones, and all that stuff exist, and a lot of people do them. Not everybody's honest. Who cares? It's not the point. But here's the bottom line. I know plenty of guys, several guys that come to mind, that do testosterone-based anabolic performance-enhancing drugs, and they kind of laugh about it, and they look good on the outside, and they're living under that veneer of youth, and they never have any problems, so they think. but the body's immune system is so powerful that it hides that little tiny tumor that grows very, very slowly, and it hides it for 10 or 15 years, and all of a sudden it's big, and it hits a nerve, or it causes a chemical disturbance or something else, and you're like, oh my God, you wake up with a tumor. That's not really how it works. You've had that for many years. But your body is so powerful to fight that and hide that. That's kind of a good and bad thing. So you got to be vigilant. And for the people who do these anabolics and don't get monitored and don't come off, and they, like the guys I'm thinking of, on for 10 years straight, 20 years straight, their blood thickens, their hematocrit goes up, and some of them do go and donate blood to thin the blood out a little, so to speak, and a lot of them don't. And really, the steroid does not kill you directly for the most part. It's the sequela, or the results, the side effects, and in this case, long-term use of testosterone-based drugs increase the blood pressure, increase the hematocrit, the thickness of the blood, and what do you get? You get primarily, for one thing, kidney failure. So that's how that happens. So it's an indirect effect, and all of a sudden you get hit with that. So again, stay on top of it. I go every 3 months. My body is my business. I got bit by a dog, as many of you know, 2.5 weeks ago. Bad bite, down to the bone in my leg. It got infected. I haven't been in the gym since. And I've gotten in kind of bad shape, and that's not good for me because my business is predicated by me being in shape and me doing videos, and right now I really can't. But I'll get back on that because I'm on top of it. I go to the doctor. It costs me money. Give up the Starbucks. Give up the going out one less night a week or whatever it might be. But get your numbers checked because we're all going to go from something. And you'd rather be the person who lives until their 90s and they die comfortably in their bed, comfortable, one night many years from now with a family all around them, hopefully. Okay, but you got to stay on top of it. Watch all that stuff. Colonoscopy, prostate exam, breast exam, get your blood checked, get everything checked on a regular basis at least once a year. That's all I have to say about that. Hope to see you soon, and go over to YouTube and subscribe because that's where all my stuff is now. And you have a great day. Thanks.